Hey YouTubers, it's your girl Nazareth, and today's video is all about trigger point injections. What are they? How are they used for the treatment of pelvic floor dysfunction? And are they worth it? If you're unfamiliar with the term pelvic floor dysfunction, please be sure to watch one of my previous videos which goes into depth about this terminology. What are trigger points? They are an area of tension or contraction within a muscle, and because of the tension, it causes pain. So you can have a trigger point located maybe at the top of your trap, in your back, and in your vaginal muscles. Who knew? There are two methods in treating trigger points. Non-invasive refers to electrical stimulation, stretches and exercises, as well as soft tissue massage performed by a pelvic floor physical therapist and the use of dilators. The invasive measure is, of course, a trigger point injection. A needle is injected into the source of pain. When treating pelvic floor dysfunction, these two methods are often used in conjunction. So in my experience, I had a pelvic floor physical therapist. I used dilators. There were stretches and exercises to do on my own, as well as the trigger point injections. There's a couple different types of trigger point injections. The first one, which is most common, is a combination therapy. It has a local anesthetic as well as a steroid. The local anesthetic really doesn't do much to break up the muscle. Obviously, it's just used sort of as a numbing agent. And people often get really nervous about the idea of a steroid being injected into their body. But it's such a small amount, and personally, I didn't experience any side effects from it. The other common method is a Botox injection, which was really surprising to me at first because I thought of Botox as, a cosmetic approach to look young and youthful, but it can actually be used in your vagina. The biggest difference between these two is the way they work. So the combination trigger point injection works to kind of put the muscle to sleep. It's kind of like putting it on timeout and helping it relax, allowing more blood flow to occur and oxygenate the muscles, which of course promotes healing. Botox, however, is actually a neurotoxin, and because it's injected directly into the muscle, it stops the muscle itself from contracting. So this can provide long-lasting effects. I've experienced both. I've done the combination trigger point as well as the Botox. So it's your lucky day because I'm going to kind of list the pros and cons of each. Let's start with the pros of the anesthetic and steroid trigger point injection. First and foremost, it's covered by most insurance plans, so kind of goes without saying, it makes it a lot more approachable. It's also important to note that you tend to feel the benefits a lot sooner than a Botox injection. So when I would get this injection, it wasn't uncommon for me to feel a difference within the first 10 to 15 minutes. And by difference, I mean I felt a release within the muscular tension. What's the downside to this trigger point injection? The biggest one for me was the frequency that you have to get these. In my case, I had to go every 2 weeks initially and then every 4 weeks. The other downside is these injections aren't as long lasting as the Botox. You'll typically feel benefits for a few weeks, hence the reason you have to get these injections frequently. So moving on to Botox, the biggest con is the price. This isn't recognized as a treatment for vulvodynia, so therefore you as the patient are responsible for the cost. You're looking at least $700, not to mention the administration fee. So your doctor will charge you a fee for performing the injection, and if the injection itself isn't covered, the fee isn't covered. So again, you might be looking at another $100 on top of the Botox. The pros of getting a Botox injection, though, I think far outweigh the price. You don't need to get them as frequently as the other injection. Typically, women will experience results anywhere from 4 to 6 months. Sometimes they'll need multiple injections, maybe 2 or 3 different times, and then actually either be pain-free or go on for numerous years with minimal pain. There are 2 methods for the injections. The first one is called transvaginal, and this means your doctor will insert 2 fingers. They will manually search for the trigger point, hold it down, and then insert the needle through the vagina into the muscle. The second method is known as transperineal. So the difference between this is instead of it being inserted through the vagina, it actually is inserted externally, so usually by the glutes inside to the vaginal muscles. I am fortunate to have experienced both, aren't I lucky? And I will tell you that both are painful. They suck. There's no way around it. I found transperineal to be more painful and more intense. Truthfully, there were a couple times I shed some tears. Not so much because I was hysterical. It's intense. Although it lasts for a minute or two, you're gonna feel it. So now that I've laid out the facts and the different kind of trigger point injections, which one would I recommend to someone with vulvodynia? And my answer is it really depends. Based on my personal experience, hands down, it's the Botox. It was much more convenient because it was once and done. I didn't have to go as frequently as every 2 to 4 weeks. Although it was expensive, I felt greater results than I ever did with the first kind of trigger point injection. So I was able to sit and walk and be physically active, zero pain, almost to the point that it was surprising. It was like my body couldn't register this feeling. And most importantly, I had pain-free sex for the first time in probably about 10 to 11 years. I don't mean to get so emotional, but those of you watching that experience pain, I know you understand. It's not just the physical pain. There's such emotional pain that comes along with it. Not being able to experience intimate relations with your partner is very, very difficult. And that's worth the $700 if you ask me. The most common side effect of the injection is, of course, soreness, which will last maybe a couple days. It really depends. I used to schedule these appointments on a Friday, so I knew I had all weekend to just kind of take it easy, not make any plans, and catch up on Netflix, basically. Another tip is to go with your partner or a friend or a family member, not only for moral support, but they can drive you afterwards. You can lie down in the back seat afterwards and not have direct contact and pressure on the vulva and the vaginal muscles. If you know you're getting these injections in advance, take a maxi pad, put it in the freezer, and the day of, bring it with you in a cooler. Bring 2 pairs of cotton underwear and you can put it in between the two. After your injection, slide on that sexy underwear with the frozen maxi pad in between, and it'll ice the area. It really decreases the pain and throbbing. So in conclusion, I think this is a really worthwhile method of treatment for vulvodynia. It's not fun, nobody wants to do it, but it really helps you feel a difference. Plus, you're going to experience greater benefits of physical therapy and the manual manipulations. I encourage you to talk to your doctor, ask as many questions as you need to, ask them to explain what's involved and what you can expect based on your individual circumstance. So until the next time we meet, make sure you are your own advocate. Don't give up, don't settle for the pain, and it can get better. Hang in there.